So this is something we've only been able to understand in the last several years or so, since there have been big enough studies to look at this. So my research group have identified a few really important factors that we believe affect the risk of glaucoma. That's caffeine intake, alcohol intake, and salt intake. So higher levels of caffeine, higher levels of alcohol intake, higher salt intake, all incrementally increase the risk of glaucoma. And it might be, if you know that you're at increased risk of developing glaucoma, say because you have family members that are affected, you may consider trying to limit the consumption of those, within reason, everything in moderation, to reduce your risk of glaucoma. There has been some work suggesting that the Mediterranean diet may be beneficial. So far, we haven't quite unpicked the complexity of the relationship between diet and glaucoma to recommend a specific diet. But a few things that stand out strongly are that higher levels of caffeine intake, higher levels of alcohol intake, and higher levels of salt intake may increase the risk of glaucoma, especially if you're genetically predisposed to it. So immediately after doing exercise, people's eye pressure goes down, but then it goes up again. I was always hopeful that people who on average exercise more would have a lower eye pressure on average, but we've looked at this really carefully and don't find that. So there might not actually be a strong relationship between exercise and glaucoma. Having said that, exercise is so good for many other aspects of your general health, I would certainly encourage it anyway. This is such a hard thing to study, we don't know for sure, but certainly levels of certain hormones in the body might influence the eye pressure and risk of glaucoma, but it's not something that we can study with certainty at the moment. So we were talking about exercise earlier. There are some exercises which in some glaucoma patients you may want to avoid. For example, during yoga, if you do any postures where the head ends up being lower than the heart, that can put up the eye pressure. Now, for the majority of glaucoma patients, please just continue doing your yoga because I'm sure it's good for you overall. And if your glaucoma is stable with the treatment you're receiving, then you don't need to worry about it. For the subset of patients whose glaucoma is unfortunately worsening despite our care, then I certainly look into things like that and might want to limit the amount of time that there is a head down posture or maybe avoid it altogether. During the pandemic, I collaborated with an excellent yoga instructor and we set up Zoom yoga classes for glaucoma patients which avoided any head down postures. Unfortunately, that's not still going on now, but hopefully it may be resurrected one day. So if you're concerned about glaucoma, maybe you've been told you're at risk of glaucoma or have a family member with glaucoma, or maybe you would like a second opinion on your glaucoma that's already being cared for, then please visit our website, Clinica London, for more information and on how to book an appointment at our clinic on Harley Street in London. To book an appointment, please visit our website, clinicalondon.co.uk.